This is Dr. K A Bhagwat from Ayush Can Center. Today we are discussing a case of a 75-year-old lady who presented to the emergency room with a urinary obstruction and a palpable lump in the lower abdomen, and a CT scan was performed. Initial topogram of the CT scan reviewed, which revealed a calcified mass that is seen in the pelvic region. And when we carefully look at this calcified mass, it has got a lobulated structure, and it is seen in the pelvis. Various differential diagnoses could be thought of in such calcified lesions, like calcified fibroids. However, we will proceed to the next axial section of the same patient's CT scan. In the pelvic region, we start seeing this calcified lesion, and the Foley's bulb in the urinary bladder is displaced anteriorly. This is the Foley's bulb. This is the calcified structure. So definitely the configuration is not of a fibroid, and when we make careful observations, we start seeing fetal parts. You can see the fetal skull. Then you can see the fetal long bone. This is a fetal long bone, and you can see the fetal spine. This is a dead fetus, and on careful observation we also see there is a calcified wall around this dead fetus. This is a calcified wall. You can see this is the skull wall, this arrow, first arrows, and second set of arrow is a calcified wall around the dead fetus. So this is a dead fetus in the uterine cavity of a 75-year-old lady, which is macerated and has a calcified wall around it. Now the question is whether it is an intrauterine or an extrauterine dead fetus with calcification, and for that we go for an MR imaging. So when we look at the sagittal T2 MR images, we can appreciate a cervix here. This is the cervix, and we can also appreciate the uterine wall. This is the uterine wall, which is displaced posteriorly. And this is a fetal calcified mass that is seen in the abdomen. And we go to look at the axial sections. On the axial sections, we can clearly make out the uterine wall which is going around the fetus. This is the uterine wall, and if you remember on the CT image, we found there is calcification in that wall. So this is the fetal uterine wall, and then the fetal skull vault. As we go lower down, we can see this is the cervix, and after the cervix we don't see the distinct uterus. Instead, this mass which is surrounded by calcification. This is a case of lithopedion, or a stone baby. This usually occurs whenever there is an intrauterine neglected fetal demise which is not expelled, and due to the autoimmune process there is a calcification all around this dead fetus to contain the dead fetus, and the dead fetus is not expelled. And many a times this could happen with ectopic pregnancies which have grown and where fetal demise has occurred without any catastrophe to the mother, and they have continued. This is a case of lithopedion in a 75-year-old lady who has 6 living children, presenting with urinary obstruction. Thank you for patient listening. You can follow me on the YouTube channel Bhagwat Kishan for more radiology learning. Thank you.